it doesn't have to be a trade-off. It just often is because there's competing interests or because the pursuit of performance is done in a way that compromises health where it might not need to be. So volume of training is an obvious one where because athletes want to get after it, they can get into a more is more mindset when perhaps doing less at a higher quality with better recovery would improve performance, but then they might feel like they're taking a risk in order to do that, and then they might lower their performance, which if it's their profession and their identity is kind of the one thing they can't do.
Well, and I think that's the way. I mean, obviously, enhancing drugs. I mean, people are, I mean, obviously, if the difference between you making $50 million a year and working at McDonald's is taking some injections, a lot of guys are going to make that decision. I
Yeah.
mean, I can see that. I think that also there are so many people competing for those very few coveted spots. And you look at like NCAA to athletes, it's like 3% of high school kids make it there, and then the number of the ones that get to Division I is 1% of that, and then it's and professional is a fraction of that, and so the teams can kind of afford to have these flash in the pan guys perform at their top level. Maybe they only can maintain it for a year or two. They get hurt, they're out. They just bring the next guy in, and so. But as an athlete, and you're looking after yourself, you got to say, what can I do to maintain my level of performance over the years, the decades, and then hopefully survive that sport, not come out a cripple. Which is a lot of what you see. A lot of these ex-athletes are just they can't. What's really amazed me is I've met a number of Olympic gold medalists, and and they're like 40, and I'm like, you look like shit, dude. What
Mate,
the hell? I mean, you're one of the best in the world, and they're like, I'm just too beat up.